Hello and welcome to this video exploring data from around the world about the coronavirus pandemic. In our previous videos, we've looked at the number and the rate of new cases around the world. We've also looked at the number of deaths and the rate of deaths occurring around the world. And we've also seen how the number of cases and deaths is related to the population in each country. Now in today's video we're going to be looking at the mortality rate. So mortality rate is basically the number of deaths that occur for each case. So how many cases per death that's happening in each country around the world. So this first chart we're going to look at is the top 6 mortality rates. So number 1 to number 6 around the world. All of this data comes from the World Health Organization. And we can see on the vertical axis there we've got the deaths per 100 cases, so that's the percentage mortality rate. The first line here shows Italy, the red line going up there. Then we've got Iran with blue, Spain, after that it's the UK with the green line, and then we have France, and finally the Netherlands. And we can see with all of those curves, we've got a steady upwards trend. Most of them have a very similar kind of slope to them. They're going up at a similar rate. The only one that's got a slightly different pattern is the blue line for Iran, which starts high and then drops down a bit before it starts to climb at a similar rate. The reason for that is probably because some deaths were occurring and being recorded in Iran before a full testing program got underway. So the mortality rate is going to depend on 2 other numbers. It's going to depend on the number of deaths and also the number of cases. This second chart is exploring the same thing, but this is countries 7 to 12. So we've seen the first 6, the highest mortality rates. And now on this chart, we've got a different scale on the vertical axis. So this goes from 0 at the bottom to 10 at the top. And on this chart, the first line is China, so we can see that that's a very steady mortality rate, which sticks around 4%. And the reason that's so consistent is because the outbreak started in China, and therefore they've collected a lot of data about cases and also about deaths. And that rate of mortality is roughly 4% consistently. We also have Japan, Belgium, Ecuador, Turkey and Brazil. And you can see that for a lot of those, they have a 0 mortality rate, which is basically because they don't record any deaths until March the 16th or thereabouts. And then we can see in the case of Ecuador, we've got that sudden upward spike where there's a few deaths occurring in the country, but there's not much testing taking place. So they haven't tested and recorded milder cases where people are not dying from the virus. Moving on to the next chart. So now we've got the mortality rate for another 6 countries. But this time we're looking specifically at countries that haven't done as much testing and haven't recorded quite as many cases in total. So the previous 2 charts were only including countries that had recorded at least 1,000 cases. So we know that they're collecting data and testing. Whereas these 6 countries here, they've only recorded between 100 and 1,000 cases in total. So not as much data, not as reliable perhaps, and maybe not as much testing taking place in these countries, or it just has a smaller population and is not getting as high a number of cases. So we can see the lines there for Iraq, Indonesia, Algeria, Peru, UAE, United Arab Emirates, and Egypt. And you can see with Peru and the United Arab Emirates, the curve only goes up right towards the end. So they're getting the first deaths in those countries around March 20th onwards. In Iraq, the red line, there are some deaths starting from March the 6th, and the line shoots up quite rapidly and then stabilizes. You can see also the yellow line for Algeria there with that peak. So there obviously a sudden number of deaths, but then more testing took place and there were more cases discovered, which brought the mortality rate down. This final chart we're going to look at is, instead of looking at the countries with the highest mortality rate, we're looking at the 6 countries with the lowest mortality rate. Again, it's only going to look at countries that have recorded at least 1,000 cases. And on the vertical axis, they're going from 0 at the bottom to 2 at the top. So up to 2% mortality rate on this scale. The red line there, we've got Ireland, blue line, Germany, yellow line, Norway, green, Austria. Pink line, Israel, and finally the orange line is Czechia, or the Czech Republic formerly. The green line looks very strange, so it shoots up very quickly for Australia. The mortality rate at the top there is only around 3 or 4%, so it's still not super high comparing it to the numbers we looked at earlier. But the reason it looks so high on this graph is because of the scale we're using. Now that mortality rate shot up because there were several deaths in Australia really before there was a full testing program and before mild cases were also being recorded and tested for. And a similar thing happened with Ireland with that sudden upward spike, and then the mortality rate drops as more testing takes place and more milder cases are also detected, and not just the serious cases that come to hospitals and more likely to end up with fatalities. It's important to think about how accurate these numbers are. The mortality rate depends on the number of cases and the number of deaths. So the number of deaths being recorded is more likely to be accurate than the number of cases overall, because if people are dying from the virus, then they're going to be coming into hospitals, they're going to be getting tested, and that's going to be recorded. Whereas with the number of cases, that also depends on how good the testing program is in the country, and that is going to determine how many of the milder cases are also being picked up in the population. Whereas in some countries, if testing is not so comprehensive, you're going to be missing some of the milder cases. That's going to bring down the total number of cases being detected, and that makes the mortality rate look higher. Just to put these figures into some context, overall around the world we're seeing a mortality rate of about 3 to 4%. Thank you for watching. Please subscribe and join me for the next video. All of the data visualizations that we're looking at in these videos are going to be made available to the public, so you will soon be able to download these and explore them interactively at home.